Hello, my name's Gareth Langley and I'm from Stardotstar. We make delightful interactive content tools and toys that improve people's lives, and we do that for wonderful people like these guys down here, amongst many others. So we're going to talk to you about a project called Ask Doctor, and our proposal is to turn our evidence-led co-designed paper prototype into a digital blueprint that we can iteratively deploy and test with our GP practice partners. The problem that we're solving is like this. Currently there's three ways that you can talk to your doctor. You can have face-to-face appointments, telephone appointments, or you can, if you're lucky, your doctor might have a fancy e-health software platform. The latter being absolutely wonderful, assuming you can work out how to register and how to get past the Fort Knox style login process. And if you're like my doctors, it turns out that once you've managed to get through all of these processes, you can't actually communicate with your doctor anyway, so that's no good. Meanwhile, you've got telephone appointments, which are great if you don't mind hanging around in a private room at work waiting for the doctor to call you. And obviously the best way to talk to your doctor is face-to-face appointments. That's on the assumption that you can actually get one. And of course we must remember that both telephone appointments and face-to-face appointments all assume that we can get through to reception to make one of those appointments in the first place. So as part of our paper prototype stage, we did a lot of research. We spoke to 432 patients across 5 GP practices, and we interviewed over 20 healthcare professionals. One of the things we found talking to the healthcare professionals is that anecdotally the people on reception feel like around 65% of their time is spent answering routine questions. Meanwhile, when we interviewed people who were, or we had surveys with the people who were in the waiting room, it turned out that 13% of them were actually in there to have a doctor's appointment just to ask a routine question, which doesn't seem very good use of time for anybody. So to sum up, avoidable appointments and avoidable calls fill up the phone lines and fill up the surgeries. This makes it very difficult for people who need to get through, and it means for one type of audience of busy people, and especially men within that group of busy people, often don't bother, which can have consequences later on, because early intervention is always much better. But with that cost being so high of having to get through to make an appointment and booking time off work, often busy people don't bother. That's not good. So our approach is like this. Ask Doctor is a web-based low-barrier communications channel for patients to ask their GP non-confidential and non-urgent questions. It's questions like, how long do I need to fast before my blood test? Or how long should I stay off work after having the norovirus? Or, every reception's favourite, is there a bug going around at the moment? I think the receptionists get asked this about 20 times a day, to which the answer is yes, there's about 1 million bugs going around at any given moment. So for patients, it might work a little bit like this. We have a doctor's website. This is our GP practice partners, the Lockside Medical Centre. This is their website. And we can see on the right-hand side, there's a little widget called Ask Doctor. If we click that, we can then go in and ask our question. We have a couple of screens that just make sure that this is not an emergency. If you do have an emergency, there are other channels like 999 or phoning up the GP surgery that are much better. But assuming that you're not in pain right now and that this is a routine question, then we can go through and ask our question. So we can select a subject. It might be about a prescription, or it might be about a drug that we're on, and you can ask that question. Then very quickly and very simply, we just go and fill in some details so that they can so that they know who you are and know how to contact you. And then we get a nice little thank you saying that we'll be in touch in the next couple of days, and it's really as simple as that. Meanwhile, back at the surgery, they have a slightly different interface where they can start to see how many queries are coming in and have a triage system to actually appoint them to different people. So people on the admin desk of Ask Doctor will be able to go and answer the questions themselves, or where relevant, go and point them to the different doctors who might be better at answering them. For a doctor, they might be able to just have a standard reply and fire those standard replies straight off. It might be about the side effects of antibiotics or whatever, or they can have some templates that are sort of part filled in, or in this case this doctor has chosen a blank template so that he can handwrite an email very, very quickly to the patient. Our approach to development is to do a lean startup model of a minimal viable product and evolve that product over iterative phases of development based on feedback and, of course, user data. And a key part of this funding will be fitting Ask Doctor into the GP business model. So obviously the reason that we're interested in this project in the first place is that it has the potential to do a lot of good for patients and for GP surgeries, but it's very important that it does fit into the GP business model. A lot of GPs are entrepreneurs, and just doing good isn't good enough. It needs to also help make them money or save them money, as well as delivering a great service. The end result, we're hoping, will be an evidence-based product that's ready for investment to scale to benefit a much wider audience across the UK. So the benefits fall into sort of four main groups, really. So let's look at the patients first of all. It allows the patient to time shift and place shift where and when they communicate with their doctor. So being able to pick up your mobile phone and contact your doctor from your bus journey in the morning or from the train is really really simple. Or being able to do it from your PC at work rather than having to hide in a private room to fight your way through reception to speak to a doctor or to speak to reception. And this new and convenient channel is particularly good for that reluctant patient, those busy people who maybe have a little question that's bugging them or just niggling them, but they don't think it's worthy of actually going through all of the effort that they would have to go to make an appointment. And no login means that there's no registration, which means it's a very low barrier to entry for everybody. That's important for digital literate people like you and I, but it's even more important for people who are less competent and confident on computers. Also for the patients, a wider benefit is that avoidable calls and avoidable appointments mean that people in greater need can get through to their GP surgery much more easily. For the GP practice, the benefits are that they can time shift these general inquiries. So when those phones are burning at 8 o'clock in the morning and at midday, when everybody's trying to phone through and make an appointment, and that's when they also get an awful lot of their general inquiries. By being able to shift some of those general inquiries to Ask Doctor, it means that they can answer them in their quieter times in the mid-afternoon or the end of the day, allowing them to give a much better service, not just to the people with those general inquiries, but to those people that need to talk to them in those peak times as well. For the GPs, having fewer avoidable appointments means that they can spend more time with the patients that need it. And to the wider society, we hope that just maybe delivering a better service to more people in a more cost-effective way will have cost benefits and health benefits to a wider public. And looking at the reluctant patient again, it's our hope that being able to start a conversation off for these people who are too busy to actually bother to make those appointments can lead to an earlier intervention, and earlier interventions, generally speaking, will have better health consequences to the patient and to society at large. They cost less as well. So to conclude, Ask Doctor is a simple mobile-friendly web application that can create a benefit to wide and needing audience across the UK. And we can't wait to get started, and we hope you agree. So thank you very much. We're Stardotstar, and we look forward to hearing from you soon.